Everybody, this is Dr. Paul Firnhaber. I'm in the part of my office today. This is Sunday morning at 10:09, and I'm at the part of my office where I adjust animals, where I take care of animals. And as many of you know, maybe not all of you, but I am certified in animal chiropractic with the state of Nebraska, certified and licensed. And so this morning, I wanted to talk to you a little bit about animal health, nutrition, and chiropractic. So, last week I did a talk on calcium in COVID and how low amounts of ionized calcium contribute to the severity and the ability to catch COVID and all kinds of other viral and bacterial infections. Well, here's an article out of a journal called Veterinary Clinics of North America Small Animal Practice. And I just wanted you to read this because I think it's really interesting, some of the parallels between animals and humans. It says hypocalcemia occurs in critically ill dogs and cats and is associated with medications, very interesting, treatments, again, very interesting, and underlying diseases such as acute kidney disease, pancreatitis, parathyroid disease, sepsis, and trauma. Possible underlying mechanisms include hypovitaminosis D, acquired or relative hypoparathyroidism, hypomagnesemia, which means too little magnesium, and alterations in the ionized fraction of calcium, which again is ionized calcium, which we talked about last week, caused by changes in chelated or protein-bound calcium. If severe or acute, hypocalcemia can cause obvious clinical signs related to muscle or neurologic hyperexcitability, or more subtle signs of cardiovascular dysfunction. Emergency treatment with calcium gluconate administration is recommended when clinical signs are present or there is moderate to severe ionized hypocalcemia. So hypocalcemia in dogs and cats is just as bad as it is in people. Now, here's another article called The Effects of Surgery and Anesthesia on Blood Magnesium and Calcium Concentrations in Canine and Feline Patients. This is out of a Veterinary Anesthesia and Analgesia. And it says, serum concentrations of magnesium and calcium have been reported to decrease during anesthesia. Although this occurs most predictably in humans and animals undergoing cardiopulmonary bypass, other reports have noted that decreased blood levels in different demographic patient groups undergoing a wide range of procedures. It says post-operative hypocalcemia has been associated with paresthesia, tetany, seizures, arrhythmias in humans. Now that's interesting because they're talking about animals here, and what they're saying is that basically the same thing can happen in animals. Now, there's another paper here that I want to talk about. This particular paper talks about how cats can develop basically kidney stones with low amounts of ionized calcium. Here's another paper called, this is out of Veterinary Clinics in North American Small Animal Practice. And I just want to read this to you. Measurement of total serum calcium has been relied on for assessment of calcium status, despite the fact that it is the ionized calcium fraction that has biologic activity. Serum total calcium does not accurately predict ionized calcium status in many conditions. For accurate assessment of ionized calcium status, ionized calcium should be directly measured. So what they're saying in these articles is this, is that ionized calcium, low amounts of ionized calcium in animals can produce the same serious problems in animals that they can in humans. And so it might be wise to add a little bit of calcium lactate to your animals' diets to make them healthier. Now, the other thing that I want to talk about today, and we're going to do a little demonstration on this, is the role of chiropractic in animal care. Now, I've been seeing a wide range of animals for a while here in my office, and a lot of the problems I get are seizures, back issues, ruptured or rupturing discs. I had a vet refer me a dog last week that had congestive heart failure that he didn't know what to do with. So I adjusted that animal and lasered it, and next week I'm going to see it again. We'll see how it's doing. But chiropractic can help a wide range of problems in animals, way cheaper and way easier than some of the veterinary visits. And so today I'm going to be showing you how I adjust an animal, and I have my financial manager here in my office, Cindy Berlin, who is going to talk to you about what's going on with her dog. And then we're gonna point the camera down, and I'm gonna show you how I adjust and laser an animal. So Cindy, if you want to come over here, and I'm gonna let you sit down right here and talk to our audience about what kind of dog we have today and what the problems are.
Okay. Hi, everybody. I'm Cindy, and I have a 15-year-old. He's a miniature schnauzer, but he weighs in a little big. He has had problems recently with his back legs. He can't get up on his own. Even like if he's in his bed that's soft, he just doesn't have very good use of his back legs. So Dr. Firnhaber is going to adjust him today, and I'm anxious to see the results, and you all get to watch.
And just a real quick, Cindy, I've taken care of this dog before, is that correct?
Yes, yes, you have.
And what were the problems last time?
The problems last time were he would be shaking a lot. They were not seizures. He was just shaking a lot, and he was like walking crooked. And you've been working on him for quite some time, so he walks straight now, which is great, and of course that's much better for his back. But he was shaking, and that's completely resolved. That issue's completely gone.
Okay, so we're going to try today and get his back legs working better. Is that correct?
Yes.
Okay.
So he can use them.
Okay, so let's bring little Bear
okay.
back here.
Come on, Bear.
Okay, buddy. Yeah. All right. So this is the instrument that I use to work on animals right here, and we're going to point this down here so you can see me work. Let's see. Let's bring this a little bit closer. Let's see. Let's come on back.
Oh, we're going to put it on the chair.
Yeah, he'll be okay back here. Okay, buddy. Okay, so this does not hurt the animal at all. So we're going to, first of all, I want to just feel his atlas. And he's out of adjustment. I can just tell by feeling the upper bone in the neck. So we're going to start there, and we're going to adjust his entire spine. Now, he's not scared of the, there we go, buddy. It's okay. Okay, little buddy. There we go. There we go. All right,
They usually end up liking it after it's done.
Yeah, these animals generally find this pretty relaxing once they get used to it. We're going to write down his spine. And I don't know if you can see this on the film, but it's he kind of jerks a little bit when I adjust him. And that's a classic, especially right here, classic example of a subluxation in a dog where he's got nerve interference. Okay, buddy, we're going to have to get you back here. There we go.
And would that, Dr. Paul, explain why he's having problems using his back legs?
Absolutely, because the nerve supply to his legs, back legs, comes out of here, and there's a lot of influence up here also. But where I'm getting most of the subluxation is down here in the back, where you have the nerve supply that comes out of the spine into the legs. So we're going to just tap him right here. I know, he thinks I'm getting a little personal there, and I am, okay? Okay, we're going to come here. Yeah, it's okay, buddy. Yeah, it doesn't hurt, does it? Hmm?
And you generally do 3 passes?
Do 3 different passes on him because we want to clear up. The first is really more of a diagnostic pass. And then the second pass, more of a treatment pass. And then the third pass, there we go, it's okay. Boy, he's got a lot going on down here.
I say he really needed this.
Yeah. I know, buddy. That floor is slippery.
He's looking at me like...
I know, you're thinking, what the hey? I didn't expect this on a Sunday morning. I was supposed to go to church, and now I'm getting adjusted. Okay. Okay, one more. Yeah, I know you're whining a little bit now. Got a little bit up here now.
Mm-hmm.
So we've kind of opened up some things here. Yeah, okay, buddy.
He's always been vocal.
One more down here. There we go. Okay. Now, so that's all the adjusting we need to do. We need to do 3 passes. We've cleared up a lot of his problems. Cindy, you want to hand me the laser?
Yes.
So now we're going to fire up my low-level laser. And by the way, I'll show this to you. This is a Class 2 FDA-approved instrument that's used by chiropractors, medical doctors, veterinarians, all kinds of different practitioners. And what laser's going to do is upregulate his neurological function. So we're going to laser the discs and the nerves along his spine so that they can heal much faster. So we're going to come in here, and what we're going to do is...
Baby, are you okay?
We're going to laser, you can see it's red, we're going to laser all along the spine to get all the nerve roots that go down into those legs. This is exactly what I do on people, except I think that animals actually respond even faster than people. They seem to be a lot more resilient. But then animals don't live till they're 75 years old generally either. So we're going to get right into the nerve roots. And then next week, in a week or two, I will report to you on how little bear is getting along. Yeah. So we're just going to laser these nerve roots that come out of the spinal cord into the different parts of his body. At least you're not shaking anymore, buddy.
Yeah.
Yeah, that's good. We just got to get your back legs working better. Okay, so we're just going to laser him. Laser does not hurt. You can't even feel it. It's absorbed by the body, and it creates a what's called a photobiologic effect in the body, where it causes the cell membranes to open up and change cellular function in a very positive way. So the cells produce a lot more energy, a lot faster, and they're able to heal at a much, much higher rate when you laser an animal. So that's what we're doing right now. And we're going to
What do you have that setting on, Dr. Paul?
setting on was nerve roots.
Okay.
Okay, now we're gonna laser them a little bit more. Okay. Okay, buddy. It's all right. So now what we're gonna do is I'm gonna set it on discs. Okay. So it's possible that he may have some disc issues that are causing the nerve root issues. So what we're gonna do is just laser his discs and get those working better, get those discs upregulated, get the function of the discs upregulated. And we're going to laser his entire spine, get all the discs.
So, Dr. Paul, would it be good to have him do this? Have you do this on him again? What, several more times?
Oh, absolutely. Yeah, we should adjust him next week. The veterinarian that trained me, Dr. Bill Inman, basically said that when you adjust an animal regularly, and regularly depends on what the animal needs, but I would say on a monthly basis, they'll usually live about 30% longer, and in that 30%, they'll be a lot healthier. So, you know, a lot of animal owners that I work on feel like that's worth it to them.
It's just like a maintenance schedule for a human.
Right, and so they'll have way less vet bills. They'll be a lot healthier and have a lot more energy because they won't have a compromised nervous system.
And all of this work that you do has only a healing aspect and no negative side effects.
There's no downsides to this at all, none. You can't hurt the animal. It's only going to make the animal healthier and heal the animal a lot faster. So, little bear here, it's getting used to me now. We've got about 9 seconds left on this. Okay. Okay, buddy. We're done. Yeah, you're all set.
See, he'll need help getting up.
Okay.
He can't.
Okay, it's a little slippery, isn't it? Yeah, this floor's a little... There we go. There we are. Okay. All right. So there you have it, my friends. That's a chiropractic adjustment on an animal. It doesn't take long. It's very powerful. It's effective. And if you have any questions, you can always get in touch with me via my Facebook page, or you can email me at drpaulf2@juno.com, drpaulf2@juno.com, and I'll be happy to answer any questions. So that's all we have for today. God bless you, everybody. And I'll be on again with another topic probably next week.